Well, non-face-to-face models of care in outpatients is one of a variety of ways at looking at different approaches to outpatients. Currently, we know that the model we have at the moment is not working. There's been an inexorable rise in the number of patients coming to hospital, and there's been an inexorable rise of patients coming for outpatient appointments in hospital. 1 in 5 of those outpatient appointments don't actually happen. That's either the hospital cancels it or the patient cancels it. Age UK is particularly concerned about the problems facing especially elderly patients having great trouble actually physically getting to a hospital in terms of very long journeys, bus rides, expenses, cost. So if we acknowledge that what we're doing currently is not working, and if we accept that we have a system that is already overrun, we know that the demand is not going to reduce. If anything, we need to look at different models to address that situation. And non-face-to-face, to my mind, has huge benefits for patients and indeed staff. Why would you want to make a journey to hospital if you could do that over the telephone or indeed via a video consultation? And quite frankly, this is just using modern day technology. Well, the health and care policy drivers are number one. The foundation of that is improving the experience for our patients. And I guess where we'd start off with is this year, the NHS 10-year long-term plan was announced. It's a whole series of rafts of measures and views for the future. And within that plan was saying, there's a very clear explicit statement that we should reduce face-to-face outpatient appointments by 30%. That is the primary driver. However, I think it'd be very fair to say that there's broad agreement and there's consensus view from some very eminent bodies such as the Royal College of Physicians, the Royal College of General Practitioners, would all endorse this view. Well, I firmly believe it will benefit patients in terms of a much better experience. So I firmly believe people will not have to travel if they don't need to travel. Of course, you need a face-to-face; you will still have to do that, but you will avoid travel. If we can reduce the number of face-to-face outpatient appointments, which, let's face it, is just swamped at the moment, it will give a better experience for those patients who actually do need that as well. And then there are a lot of the other associated benefits of this. We know we've got a significant issue with the carbon footprint. The NHS contributes to 40% of the carbon footprint from public services. We know approximately 10% of cars on the roads are related to outpatient activity, and that for the future generation will make a clear impact on reducing the carbon footprint.
So I think for patients, it's giving choice. It's benefits of having choice. Not everyone wants to have that choice or will use that choice, but the fact it would increase our options and increase our choices of how we interact with any kind of services that are being provided or hopefully provided to us. I think for me, my vision of how it can benefit, and I think we have to make sure we've talked to people about what the benefits are. It's around hopefully efficiency. I'd like to think it's be a more efficient way, that things could be done in a real-time or have more real-time impact. I think it's about having more clarity of transparency, because I'd like to think that the benefit is that I can actually see what's going on between either something that's sent by my GP to a provider to the service that I'm going to use. I guess for many of us it's all about non-travel, the number of days in our life that we've lost in sitting in outpatients because it's just been either really busy or, it's just the getting there. You've got to have a day out of your life. The one thing that non-face-to-face clinics is providing, if you like, is what we ought to be doing already, is offering people that form of communication that is done in a different format, because that's making it more accessible to us anyway. So in a way, the two go hand in hand for those of us who've got different kind of communication needs, that it could be more responsive. A non-face-to-face clinic, it could be more responsive to what we're wanting in the first place, or what our needs are in the first place.